Therefore, the heart becomes congested. As the result, the heart cannot pump enough oxygen to meet the body's demand. We can divide the heart failure into the left-sided heart failure, which includes the left atrium and the left ventricle, or the right-sided heart failure, which includes the right atrium and the right ventricle. Now, heart failure can be either due to systolic dysfunction, which is the inability for the heart to contract and push out the blood, or diastolic dysfunction, which is the inability for the heart to relax. So here's some of the risk factors for congestive heart failure. CAD, in which the major blood vessels that supply the heart muscles with blood and oxygen become narrowed or diseased, leading to damage to the heart muscles. Myocardial infarction or heart attack, which is the death of the heart muscles due to an ischemic event. Cigarette smoking. Hypertension, which leads to left ventricular hypertrophy, which makes it harder to oxygenate the heart muscles and can eventually lead to ischemic damage to the heart muscles. Obesity and diabetes, which can both lead to CAD. Heart valve disease, such as aortic stenosis, which can eventually lead to left ventricular hypertrophy and ischemic changes, similar to hypertension. Cardiomyopathy, which is another name for heart muscle disease. For example, dilated cardiomyopathy, in which heart's ability to pump blood is decreased because the heart's main pumping chamber, the left ventricle, is enlarged and is associated with alcohol and viral infection. Hypertrophic cardiomyopathy, which is associated with thickening of the heart muscle, most commonly at the septum between the right and the left ventricle. Restrictive cardiomyopathy, which is a condition in which the walls of the heart are abnormally rigid and lack flexibility to expand as the ventricle fills with blood, and it's associated with amyloidosis and sarcoidosis and fibrosis. Even though both the left and the right-sided heart failure pretty much have the same clinical features, the left-sided heart failure presents with symptoms associated with pulmonary edema, which is due to failure of the left ventricle to sufficiently remove blood from the pulmonary circulation. This leads to fluid accumulation in the lungs, and the clinical features such as dyspnea or shortness of breath, paroxysmal nocturnal dyspnea, which is the sudden worsening of dyspnea at night during sleep, and orthopnea, which is shortness of breath that occurs when laying flat and improves when sitting up and standing. And also, since the heart is not pumping out enough blood, there is going to be decreased
alon-alon sing penting teko cari duit mas tukunin jepara aja balik aku mesti teko piye to dik jarine janji ning alon-alon Jepara nganti wengi kok ora teko-teko to dik iya ra lali ya mas Asma marang siramu pancen kowe bocah